Hello, hello, and happy Halloween, everyone. Welcome to a special edition of Nursing Matters by the RN Network. I'm your host, Christina Archer, and today I'm bringing you spooky, strange, and surprisingly helpful tales from the world of nursing. Don't worry, it's not all bumps in the night and ghost stories. We got some real-life health insights and a healthy dose of humor to make sure your shift isn't the scariest thing you face today. So grab that pumpkin spice latte, pop in those earbuds, and settle in. We're talking burnout monsters, phantom stresses, and a few fun tricks to keep the goblins of fatigue and foot pain at bay. Each segment will take us into a different corner of the nursing world with a story that's more treat than trick. And maybe, just maybe, we'll end with a goodie or two to take you straight into November. All right, let's get this ghoulish show on the road. Whether you're on your way to work or catching a break, I hope this Halloween edition adds a little boo to your day. Now, without further ado, let's step right into our first story, protecting those precious feet.
Nurses, are you ready to expand your professional network, build meaningful relationships, and engage with fellow nurses from all over? Join the RN Network online community on LinkedIn. It's the perfect place to connect, share experiences, seek advice, and even post your own insights. Whether you're looking for career advice, job opportunities, or simply want to be a part of a supportive nursing community, the RN Network has you covered. Ready to join? It's easy. Visit rnnet.org/LinkedIn-groups to sign up and become part of a thriving community of nurses just like you. Again, that's rnnet.org/LinkedIn-groups. Don't miss out. Network, engage, and grow with the RN Network today.
Today's first story is all about something we often overlook in nursing: your feet. Minority Nurse recently shared some essential tips for keeping your feet happy and healthy on the job. Think about it. As nurses, you're on your feet almost constantly, and when your feet hurt, it's really hard to stay focused on patients. Their advice includes investing in quality shoes, adding orthotics if needed, and incorporating some quick, effective foot stretches during breaks. A simple tweak here and there can do wonders, especially during those long shifts. Foot care isn't just about comfort, it's actually science. According to experts, choosing shoes with a wide toe box and strong arch support can significantly reduce foot strain. And compression socks? Not just a fad. They actually help reduce swelling and improve blood flow, making them a lifesaver during those 12-hour shifts. When it comes to foot health, a little preparation goes a long way. For nurses, healthy feet are a matter of workplace sustainability. There's so much physical strain in this profession, and those aches and pains can really add up fast. But by taking small steps to protect your feet, you're not only protecting your body, but also extending the ability to care for patients effectively. No one needs to deal with sore arches on top of everything else that's happening that's so hectic in a hospital. And here's something to think about. Everyone knows the regret of wearing uncomfortable shoes to an all-day event. Now imagine that regret lasting an entire career. I think nurses deserve foot care perks like pro athletes. After all, you're doing a marathon of a different kind. Next up, let's dive into something a bit trickier: the impact of commercial contracts in healthcare. Recently, Modern Healthcare discussed how shifting payment models, especially with Medicare, are affecting hospital revenue. Commercial contracts are essential for hospital operations, but they come with some strings attached, especially when paired with Medicare risk-sharing models. This shift has placed added pressure on hospitals to carefully balance their financials while still providing top-tier care. The American Hospital Association notes that many hospitals are adapting by restructuring their financial models to keep up with rising healthcare demands and fluctuating reimbursements. Interestingly, the push for value-based care is encouraging facilities to adopt these alternative payment models. It's a way to prioritize outcomes over volume, though not without its challenges. Balancing patient-centered care with economic realities is a super tough act. For nurse leaders, understanding these financial models can provide better insight into budget constraints and staffing decisions. Knowing the bigger picture can help leaders advocate for resources and policies needed to improve working conditions. After all, when hospitals are financially healthy, the whole system benefits, especially the staff who keep everything running smoothly day to day. Outside of nursing, we all know that financial juggling act when expenses keep climbing. It's like trying to manage a monthly budget that never looks the same. Only in healthcare, those budget changes impact lives. It's really a lot to think about, and it's just one more reason to appreciate the work nurses do under complex and often constrained conditions. Our next segment takes us into the future with AI and cancer care. MetroHealth is testing a conversational AI with cancer patients, as reported by Healthcare Innovation Group. The goal is to make health interactions easier for patients by answering questions about treatments, appointments, and self-care, all through a virtual assistant. For patients dealing with cancer, any relief from administrative hassle is a true game changer. AI in healthcare is evolving fast. Studies show that these virtual assistants can help reduce anxiety for patients by providing immediate answers to common questions. While it doesn't replace human interaction, it does streamline routine inquiries and empowers patients to get involved in their care. The tech doesn't diagnose or treat, but it makes sure patients feel heard, an essential component of the care experience. For nurses, this kind of technology could mean a reduction in non-clinical demands. Answering patient questions is important, but when tech can handle the simple stuff, nurses are freed up for more critical care tasks. That translates to better time management and potentially less stress on staff. And with burnout rates on the rise, every little bit helps. Let's face it, from a non-nursing perspective, who wouldn't want an AI assistant to field the basic questions in life? Imagine having a digital helper to explain insurance paperwork or remind you about flu shots. In a way, it's like having a personal ghost who's always got your back. Just getting that Halloween reference in there. Now here's one that'll keep you on your toes: psychedelic medicine. MedCity News recently explored the resurgence of psychedelics in healthcare, especially as mental health treatment. It sounds like something out of the 1960s, but research today is seriously considering psychedelics to treat PTSD, depression, and anxiety. Although still experimental, these treatments show promising results in preliminary trials. Research from Johns Hopkins Medicine supports this potential. They found that guided sessions with psychedelics can help patients process trauma in a controlled environment, offering new hope for treatment-resistant conditions. It's not your typical approach, but when done under professional guidance, it might just be the breakthrough that some patients need. For nurses, especially those in mental health, this new frontier is both exciting and challenging. It requires a shift in mindset and the development of new care protocols. Understanding how to support patients through such unique therapies will be essential as these treatments become more mainstream. Plus, it opens up new specialties and opportunities for professional growth in mental health care. From a broader perspective, it's a reminder of how healthcare is always evolving. What was once taboo is now being revisited from a scientific lens, offering a fresh perspective on healing. It's like a Halloween candy you weren't sure about ends up being surprisingly delicious. Psychedelics, who knew, right?
Attention nurses, are you ready to take your career to the next level? Look no further than the RN Network, your ultimate online community and job board designed just for nurses. Whether you're searching for your next great opportunity, need career advice, or want to connect with fellow nurses, rnnet.org has you covered. From exclusive job listings to valuable resources like continuing education and professional development, we're here to support you at every step of your nursing journey. So why wait? Head on over to rnnet.org and join the RN Network today, because your next opportunity is just a click away.
Moving on to something that's been stirring up concern: bird flu. According to WebMD, federal experts are ramping up discussions about the what-ifs surrounding a potential bird flu outbreak in humans. While it's currently more of an animal issue, mutations have led to cases in humans. The article discusses the importance of surveillance and preparedness, noting that healthcare professionals might be the first line of defense if the virus becomes a more widespread problem for humans. Experts at the Center for Disease Control and Prevention are closely monitoring the H5N1 strain, which has already led to some serious outbreaks in poultry. The CDC emphasizes that while the risk to humans is still low, it's critical to have robust planning and a clear protocol. For instance, learning from past pandemics, the CDC is investing in vaccine research and preparing medical countermeasures just in case bird flu makes the jump to broader human transmission. For nurses, particularly those in emergency and infectious disease specialties, keeping up with this information is key. Preparedness isn't just about protocols, it's about staying informed. In the event of a surge, nurses need to be well versed in patient protection, vaccination, and preventative care. This story is a good reminder that as nurses, part of the job is staying one step ahead, even if that means preparing for something that may never come to pass. And outside of the nursing world, who hasn't just had a just-in-case plan? Whether it's an emergency kit in the car or an umbrella in your bag, sometimes planning for the what-ifs just gives us peace of mind. And when it comes to health, we can all appreciate a little preparedness. After all, better safe than sorry, right? All right, here's one that may sound less scary, but it definitely raises some eyebrows. Black plastic spatulas might be leaching harmful chemicals into our food. The Atlantic recently published a piece revealing that flame retardants are often present in these common kitchen tools. When exposed to high heat, these chemicals can potentially leach out, posing risks to our health. It's one of those things we don't think about, but once we know, it's really hard to ignore. The Environmental Working Group has long cautioned about using plastic utensils with non-stick or high-heat cookware. Their research shows that alternative materials like stainless steel, silicone, or wood are safer options for cooking. Heat-resistant materials tend to be more stable, meaning there's less of a risk of chemicals leaching into the food, something to consider for nurses and health-conscious cooks alike. For nurses and other healthcare professionals, this might seem like a minor issue, but it highlights a larger theme: small, everyday health risks that add up over time. Nurses are educators as well as caregivers, and sharing these small health tips with patients can make a big difference. It's all about building healthy habits in all areas of life, not just the big stuff. And personally, I have to admit, I'm rethinking my kitchen drawer right now. If nothing else, this article was a great reminder that sometimes out of sight, out of mind isn't the best approach. Next time I'm flipping pancakes, I'll probably reach for the wooden spatula, and hey, it's a simple switch that makes me feel a little healthier. Communication is at the heart of everything you do as nurses, so this next segment hits close to home. Emerging RN Leader recently explored the importance of teaching nurses to be more effective communicators. As healthcare becomes increasingly complex, the need for clear, concise, and compassionate communication has never been more critical. Whether you're talking to patients, families, or other healthcare professionals, the way you communicate can change outcomes. The Journal of Nursing Scholarship backs this up with studies showing that communication training can improve patient satisfaction and even reduce medical errors. This kind of training often includes role-playing scenarios, simulations, and real-time feedback. Many nursing schools are starting to make communication courses a core part of the curriculum, emphasizing that soft skills are just as essential as clinical skills in delivering quality care. For nurses, particularly those in leadership roles, strong communication skills are invaluable. They help foster teamwork, build trust with patients, and enhance overall job satisfaction. Being able to advocate for patients and articulate their needs is essential, especially in high-stakes environments. This story is a reminder that while medical knowledge is critical, the ability to communicate effectively is just as powerful. From a non-nursing perspective, good communication is a game changer in any field. Think about it. How often do misunderstandings happen simply because we weren't clear enough? It's a skill worth honing, whether you're in healthcare, business, or just trying to order the right coffee. As they say, it's not about what you say, it's how you say it. And in nursing, nothing could be truer. Finally, let's talk about a new trend in nursing education, gamification. Nursing Education Network recently highlighted how gamification, like the formula used in apps like Duolingo, is making waves in nursing schools. The goal is to make learning both engaging and memorable. Through quizzes, interactive modules, and point systems, nursing students are motivated to make studying a daily habit, just like practicing a new language or playing a game. Studies have shown that gamified learning can increase retention and reduce stress, making it easier for students to grasp complex topics. According to the American Journal of Nursing, gamified courses and interactive simulations boost engagement and provide real-time feedback, which is crucial for mastering clinical skills. It's learning, but with a twist that keeps the student coming back for more. For the next generation of nurses, this could be revolutionary. It makes learning more enjoyable and accessible, which is essential in a field with so much information to absorb. And for nurse educators, it's an innovative way to connect with students and make complicated subjects more approachable. A game may not replace hands-on experience, but it can make the knowledge stick, and sometimes that's half the battle. And hey, from my own non-nursing life, who doesn't love a little gamification? Whether it's hitting daily step goals or trying to learn a new language, making things fun is a great motivator. It just goes to show that sometimes the best way to tackle a challenge is to turn it into a game. In this case, the stakes are higher, but the idea is the same. So, learn, grow, and maybe even have a little fun along the way. That's it for this Halloween special of Nursing Matters. I hope you enjoyed today's mix of treats and tricks from the nursing world. Remember, whether it's preparing for bird flu or reaching for a safer kitchen utensil, knowledge is power, and a little bit of humor never hurts either. As we wrap up, I want to wish each and every one of you a happy Halloween. Take care of yourselves, stay safe, and enjoy the spooky season. You earned a treat, so grab that candy corn or maybe a handful of chocolate and celebrate all the incredible work you do. Thanks for tuning in, and until next time, keep it spooky, keep it strong, and I'll see you on the next episode of Nursing Matters. Happy Halloween, everyone.